Assalamu alaikum. I welcome you all in this lecture. Today we are going to discuss about the factors used to calculate sample size for any study. So there are four possibilities whenever we are designing a study, and especially in a randomized clinical trial where the objective is to estimate the treatment preference, okay, whether the treatment of our choice has any advantage over another one or is not. So there are four possibilities in a study evaluating whether the treatment differ or not. So we correctly identify that both the treatment, which is the new treatment as well as the already known treatment, don't differ. There is no difference between the newly established treatment and the prior one. Or we can say that there is a difference. There is a difference, and we correctly identify both treatments differ, right? So these are the two exceptions which are going to be reported. Number two and number three is we incorrectly identify a difference, but in reality both treatments don't differ. All right. First, there is no treatment difference. Second, we incorrectly identify a difference, but in reality both treatments don't differ at all. Thirdly, as I have mentioned, we correctly identify both treatments differ. And fourth one, these are the fourth possibilities. So the fourth possibility is we incorrectly identify that they don't differ, but in reality there is a difference which has to be reported. Alright? So in order to summarize these findings, we can draw a table. That is what a reality looks like. This is a reality image, and over here what we have observed on this binomial table, we have seen that what we are observing. So there is a consensus that treatments are not different. Now the treatments are not different, there is an agreement we have established, that's good thing. Or the treatments are different, in reality the treatments are different, that is also an agreement, and these are the two possibilities could be addressed. What if we are incorrectly identifying the treatments are different? If we identify the treatments are different, that is type 1 error, and it is reported as alpha, and it is usually written as with a p-value of 0.05 or 0.01. That means 0.05 means that out of every 20, one individual may get a chance or a probability of getting these findings wrong. Okay, so that's what is called type 1 error. And if the treatments are not different, what we have observed, but somehow we say that the treatments are different, and this falls over here, the category of type 2 error is reported. I have elaborated this type 1 and type 2 error in my other video. You can pop on and log into that video, and where you can explain the type 1 and type 2 errors. But over here for the sample size estimation, it is just a quick recall about type 2 error, which is called as beta, and since the probability never exceeds 1, so 1 minus beta is the power of a study. So the study power is usually written as 1 minus b, or agreement value. So the treatments are different and we agree with this, is called the power of a study, 1 minus beta, and the type 1 error is alpha. Now things we need to know in advance for any sample size estimation is: number one, difference in response rate to be detected. If there is an already established treatment, how much our proposed new treatment is going to increase or decrease the response rate. So the first foremost thing is the difference in response rate to be detected. Now the estimate value of a response rate in one of the groups. If we are talking about, let's say if we are talking about a new treatment versus an old treatment, the first factor we need to know is, let's say there is a difference in response rate. The earlier treatment cures 30% individuals, and our proposed treatment cures 40% individuals. Now this is just an estimate, this is a proposed value. You can just formulate your understanding on any of these numbers. So to be on realistic side, the difference is always calculated as 10% and 20% increased response rate. So the difference is, let's say over here would be 10% because 40 minus 30. The estimate of response rate in one group, that is already known, and this could be known to us by review of literature, by animal model studies, or by anything close to that value. A is the alpha level of significance. I have mentioned in my previous slide. Alpha values are generally written as 0.05 or 0.01. Those are the significant p values we are assuming over here. Now the power of study means that how much agreement we are estimating. The value usually retained as 80 to 90% is the power of study that we want to be. And is it the study is one-sided or two-sided study? One-sided study literally means that since we are launching a new treatment, so we always assume that the treatment has a preferential advantage for our patients. So that's a one-side story. But whether there is a chance that instead of 40% patients improvement, we can expect there is a 20% improvement, 20%. So in fact, the old treatment is much more beneficial rather than the prevailing one. So this would be called as two-sided study. So generally in medical research in public health, we as an investigator or clinicians believe that there is a one-sided study because we assume that the new treatment has a preferential advantage. So in short, to remember these 5 factors, we can say DRAP, difference, response rate, alpha value, p power of a study, one side or two-sided study. So now there are a few questions which I would like to elaborate over here quickly. What if we don't know the response rate of an earlier treatment? We are dealing with a very fatal disease like COVID, where there is no already known established treatment available. In that case, we always find that whatever the response rate is always towards one sided of a story because the patients are already dying. So we say that the new treatment is always beneficial and our response rate may fall from 30% to 40%. So this is a generalized consensus that all the new treatment, a new marker or a new drug will improve the response by 10 to 20% from an available value of 30%. In case there is no earlier finding about a treatment, we assume that in fatal diseases the response rate would be roughly around 30% improved. But if we don't know about the estimated response, guesswork is used, as I have mentioned, 30%. Now 1 minus b, that is the power of a study. It is usually ranged as 80% to 90%. Alpha values are quoted over here. Alright, so these are the 5 factors we need to know in advance before we study a sample size and estimate a sample size. So let's assume that we are conducting a trial for a new therapy, one that is currently in use as a cure or response rate of 40 individuals, 40% patients recover. Now we believe that in new therapy may cure response rate 60%. Now this is our estimated what you can say response value. We just assume this value. This means we assumed an improvement in cure of 20%. That is the first D of DRAP value. So we calculate the number of patients required for this new therapy. There are several tables which have been established and proposed. In this regard, the first foremost table was suggesting that based on the smaller proportion value, the first value says 40% response rate. Okay, the 40% response rate is mentioned over here as stated in this regard. 40% value stays over here. Now the number of patients we require according to the difference in response rate. So we believe 60% response of our new treatment will improve. So from this value we go ahead and we assume that 40% initial response of our old treatment will be improved by 60% response as mentioned in the question. So the difference is 20%, 0.2, right? Now if we coincide these two numerical values, we will see this is the 97%. 97 number of individuals are required to enroll for this particular new treatment assessment in comparison to the old treatment. Okay, so this is how we calculate our number of individuals or sample size for any study. Okay, so that's a pretty straightforward thing. Now in order to increase that response, we will also check that value in alternate ways. So the difference of response rate with the old treatment response is going to help us to calculate the sample size. Okay, such kind of tables are already available at different forums. What I am trying to teach you is those 5 factors which are kept in mind to design any sample study, and those factors are briefly over here. They are called D, R, A, P, and then either one type study or two-sided study, right? So these are called DRAP. Thank you very much for your time.